Good morning. This is Dr. Timothy Scott Beck here. It is August the 4th of 2025, and I'm giving you my morning video update today. So let's talk about a few things. First of all, the most prevalent thing going on right now is school has started back. Okay, and the thing I want to say about the school is usually after school starts for the next several weeks, we get very, very busy, mainly with viral infections going around the community. And so it would be a good time to review your hand washing technique and your use of hand sanitizer, just like we were always talking about with the COVID pandemic. So during this period of time, when everybody gets back together for school, I think there's just an explosion of viruses going around the community, getting exchanged, and children are not as good as we are at protecting ourselves from these viruses. So the best way you can protect yourself is using a frequent use of hand sanitizer, keeping your hands out of your mouth and out of your eyes when you're around other individuals. I'm hesitant to say, like we used to with COVID, to isolate yourself with a virus. It's just, if you do have a virus, you need to be considerate of other people and make sure you're washing your hands on a very frequent basis. But if you get one of these viruses, I will tell you that the first few days that you have the virus, there's no real treatment for it, okay? And the only thing we ever treat is if you get a secondary infection. Sometimes we'll treat the symptoms, like the cough or the congestion, but most of that stuff can be handled with Delsum or some over-the-counter stuff. Our main purpose is to catch you if you get a secondary infection from that virus. And what I mean by that is, just say you get an upper respiratory virus and you get it and you get congested and you go through the whole rigmarole, but then 5 days later, your head feels like it's about under a lot of pressure and your eyes are watering and you're just not getting better. That probably warrants a visit with potential antibiotic therapy. Otherwise, during that time, you can use saline rinses to kind of help keep your nose clear of the stuff, and use Mucinex. That works too. Delsum is the cough medicine that we prefer that you use over the counter. So there's a lot of ways to combat it, but just be aware that it's that time of year, and we're here for you to help you with that. The other thing I was going to talk about is I want to talk about adjustment disorder / depression. And what I'm talking about is when a lot of people come to me and they're like, my anxiety's out of control, I'm crying all the time, I don't feel good, I don't feel right, I feel depressed or I feel low, like you don't want to deal with other people, you don't want to deal with your life, things like that. So there's different degrees of that. Typically when I'm talking to somebody and they're experiencing these things, and let's say they got all this going on, but they're also having something going on. They've got a new job, or they've moved to a new community, or they're having trouble with their spouse or something like that. So I call that an adjustment disorder. And what I mean by that is you're not really depressed, but you got some really bad stuff going on in your life that's making life hard to deal with. Okay, that's adjustment disorder. Okay, and those are usually not as severe as depression. And depression really is when you start feeling these symptoms of feeling low, low self-esteem, anhedonia. You don't want to, nothing makes you happy. You're not happy around anybody. Things like this, and they go on for like 3 months in a row. Then we start calling that depression. So we have treatments for both of those. They're similar. I usually, if they have adjustment disorder, I can give somebody just a little micro dose of some of these antidepressants, not a big whopping dose, just a little tiny bit to get them over, to just help align their thinking where they're more productive thinkers and can work through some of this stuff on a more logical basis. And it just just makes like I said, it makes a little more sunshine, a little less rain in their life. And usually it doesn't take a big dose. It can be a really tiny dose to do this. Now, some people need more. Some people have a lot more going on to this, and some people have genuine depression, which depression can come on whether you're having bad stuff going on outside of your life or not. In other words, everything can be just perfect and you can get depressed, which can be a little bit more of a hopeless situation, right? And I see this a lot with people who have a lot of money or who have a lot of resources. They're a little bit more hopeless than everybody else because they've got everything. And that can be a very perilous situation for somebody when you don't feel good and everything's in line. Okay, then that usually has to do with a chemical imbalance in the brain. It's treated similarly, and we follow you along and we do the best we can. And of course, with treatment for these things, counseling and therapy are always really good to help with that, but also it can augment the medicine and help you feel better quicker. So anyway, these are some things that we deal with on a daily basis. You can come in for this if you feel like this is a problem for you, and let's talk about it. Doesn't mean I'm going to treat you. Doesn't mean that you're going crazy. It just means, hey, we've got some challenges that we need to mediate as we go through. So, and we can help you with it. And again, we can refer you to counseling or psychiatry if that's needed. A lot of times that's not needed. I can take care of a lot of stuff right here. And I have lots of experience with this stuff because I have been doing it for a long time. But anyway, we also got our backup plans to help if we need to. Thank you so much for listening to me today. And it is a rainy day. So remember, it's good for your mental health to walk in the rain. I know that for a fact. Okay, if you need us, give us a call at 706-782-0016. Otherwise, I'll see you when you come in.